Good morning. My name is Dustin LeNorman, and we're here to talk about my perspective of evidence-based medicine or evidence-based practice. Currently, I would say that my education level on evidence-based practice is new, as well as a little lacking. But for what I perceive as what evidence-based medicine is, it's the ability to do research or collect research or educate yourself on research as to the best practices for patient care. And for these evidence-based medicine procedures or techniques for the patient, we must formulate a question first, and this is going to help us either conduct the research or enable us to do research, to do searches for literature that will help us find our goal target as far as our question goes. And within that question, we need to have our patient or patient population. We need to have our interest, be it our treatment or interest of modality, and then a comparison for that. So what are we comparing that information to? What are we comparing it to as far as, are we determining it's better than one treatment compared to another? And then what is the outcome that we're looking for in this actual modality or evidence-based practice that we're trying to determine here? And that outcome should be somewhat patient-oriented, or it can be clinically oriented. We are, as a profession, as athletic training and medicine, going more towards trying to understand patient outcomes and patient-oriented evidence that matters. So this is a great topic and great opportunity for clinicians to develop skills and techniques that are better suited for our patients and incorporate those into our daily activities as a clinician. Second, in the evidence-based practice, is that we need to search for the literature so that we can determine what literature we are looking for, gain a breadth of compiling that literature in order for us to be able to read through, and then in the third step determine what is critically appraise that literature, so that we can determine if this literature or the question at hand, what we're presented, is it valid? Is it usable? Is it useful? Things of that nature. And then the fourth step in this would be to implement the information that we've learned as evidence-based medicine in order to present that on a clinical level for our patient and determine how well our outcomes are going to be. How do you utilize this evidence-based practice in athletic training? Currently, I'm trying to involve it in a more in-depth process for my patients/athletes. Do more research, read more articles, find out what other people are determining is quality evidence for a particular modality in question, as compared to maybe something that I've done in the past, but yet you'll still use my clinical experiences in order to treat the patient. Secondly, we have to always take in consideration the patient's desires or patient's outcomes, goals that they are interested in setting. Do I feel prepared to practice evidence-based technique? I think in the old mindset, I feel as though maybe I was, but learning through this process and seeing that there's terms that says clinical expertise in a technique or skill takes 10,000 hours is pretty significant, and to try to be able to have 10,000 hours of practicing that, is it truly telling me that I'm able to practice that technique at a skillful level? It's very intriguing and has definitely opened my eyes up to say maybe we are practicing at a at a proficient manner rather than a clinical expertise manner, and then it is good for us to have those skills so that we can have a more integrated approach to our athletes, and not just, oh, we're good at this one particular skill, one particular modality. We're good at rehab as compared to manual therapy or any of those things, that we are better able to package everything as a whole for our patient. And then last, how much experience do I have with evidence-based medicine? To be completely honest, it's been limited until this time. It's been almost 8 years since I graduated from a master's program, and things have changed in the clinical education since then. I don't recall very much evidence-based practice being presented within our curriculum in the master's program. So I've had to learn from teaching as an adjunct faculty and how these things are being implemented deeper into our curriculum at the undergraduate level, to be able to determine and educate myself and present this material in a manner so that we can continue to educate our new students. So it's definitely been a learning curve for myself, and it's been a great learning curve. I've always expressed that you have to learn in order to teach, and in order to teach you continue to learn. So it has definitely been beneficial for me to have that opportunity to try to continue to advance my knowledge in evidence-based practice. I look forward to the opportunity to kind of dive in deeper, and it's definitely something that is intriguing. And was actually speaking to one of our team physicians here this morning, who's also an ATC, and we were talking about evidence-based practice and patient outcomes, and talking about patient-oriented evidence that matters compared to clinically driven information. And it's definitely intriguing to consider the patient's goals, and is this modality on a physiological level is that what we're looking for? How does it change the patient's body, or at a physiological level, compared to what is their goals? What is it that they wanted to return to activity, even though they may not have a particular range of motion that they had before? What is it that they have now, and is it hindering them or disabling them from competing at the level that they were? And if not, then we accomplish the patient outcome goals based on that modality or the skills that we provided for that patient. So that's currently my perception of evidence-based medicine and evidence-based practice. I look forward to diving in a little bit deeper. Thank you. Dustin LeNorman.